Okay, so good morning, everybody, and welcome. My name is Ken Plord, and I will be facilitating this event today. I'd like to just introduce some of my teammates here. We have Jennifer Jacobson, we have Lisa Mason, and Shay Montemuro. They will be monitoring the chat box today. And just a few housekeeping items before we get going. If everybody could just please turn their microphones to mute or their cell phones to mute, however you are tuning in today. And just a reminder also that this presentation will be made available on our YouTube channel. I will put that link up at the end in one of the last slides. And we will also be emailing you this presentation along with a few supplemental materials today. So let's walk through a little bit about how this presentation will go today. We will begin by walking you through the media sector within the Strategic Prevention Framework model. You will gain knowledge of different levels of sector involvement. We will learn from a shared experience through a coalition speaker. Today we'll actually be hearing from a few speakers. We'll be hearing from Elizabeth Jadovich, who is a former youth peer advocate of the West Hartford Prevention Partnership. And she'll be sharing some interesting ways that she engaged with media in her time on the coalition. We'll also be hearing from Michael Awad from the New Haven Prevention Council, and he'll be sharing some of the very interesting ways that his youth has been using influencing social media. And we'll lastly hear from Lisa Mason, who will share some of how we will be using the libraries and media during National Prevention Week this year. After that, we'll identify ways to engage the media sector. We will identify barriers to deeper levels of participation, and again, provide you several tools around the 12 sectors. So let's take a look and review the strategic prevention framework for just a moment. So again, these are 5 steps, and they have 2 guiding principles that offer planners a comprehensive approach to understanding and addressing substance misuse and related behavioral health problems in their states and communities. The 5 steps of the SPF include assessment. Basically, what is the problem? 2, capacity. What do you have to work with in your community? 3, planning. What do you have? What should you do and how should you do it? Step 4, implementation. How are you going to put your plan into action? And then finally, evaluation. Is your plan succeeding? And we'll examine the process around the outcomes of programs and practices. Now, it's important to note that the SPF is also guided by 2 principles that should be integrated into each of these steps. 1, cultural competence, and I'll read this definition to you: the ability of an individual or organization to understand and interact effectively with people who have different values, lifestyles, and traditions based on their distinctive heritage and social relationships. And then the last principle is sustainability, which is, how are you going to achieve these long-term results? So let's take a look at media and how this fits into the SPF. And media, I have to say, is definitely my favorite of all the sectors because it allows for the most creative space, if you will, I've found. So let's take a look. And remember, media are not limited to traditional channels such as newspaper, radio, or TV, or broadcast media. An ever-expanding variety of web-based vehicles and other channels such as school or business newsletters exist. Identify individuals within your coalition, perhaps youth, that can help you use these new electronic media. Utilizing the most appropriate of these vehicles is essential to your coalition's success and sustainability. If your coalition operates in a rural area where there are a few traditional media outlets, such as daily newspapers, radio, or television, You know, maybe capitalize on resources that are available, like bulletin boards at grocery stores or retail shop windows. Just remember that media opportunities are everywhere. So get creative with this and have some fun. So if we look here on the left, some traditional or some examples of that you may use in your community for media: newspapers, radio, television, social media, websites. But have you considered books or libraries as media resources? Do you do mailings, either email mailings or US postal mail mailings? Have you considered graphic design professionals or local photographers, or even communication students? Now, some of the activities that you may do with media in prevention could include contacting local news outlets prior to hosting events or launching social marketing campaigns. You may also do this if your coalition plans on launching events during National Prevention Week. Also, consider connecting with community access TV staff. Oftentimes, community access TV stations are located within your town hall, and oftentimes their services are free. So be sure to take advantage of this. Consider hosting a book discussion on a book relevant to prevention at your local library or media center. Post on social media, either video or educational posts. Consider your website as a resource to everybody in the community, and target audiences by mail. So right now I'm going to go to our first poll. Let me just pull it up here, and we're going to ask, which of the following media agencies does your community utilize? Let me get that. So if you could all participate in this poll. We'll go just a couple more seconds. Okay, so let's take a look. Looks like social media is the big winner. Can everybody see the results okay? Give me a thumbs up if you can. Okay. So let's see here. So libraries and media centers, about 33% are utilizing them. Television, so some of the traditional outlets like radio and television, not as many folks are using. Other, I'm curious, could anybody who put other speak to that, if you will? Does anybody want to?
Hi,
I guess it's really,
oh, sorry. Go ahead.
I guess it's really a newspaper, but we do utilize the school-based newspaper for promotion of our teen council.
Okay. And Kathy?
Billboards. We do a lot of billboards, so.
Yep. Okay, great.
I was going to share church bulletins as well.
Okay, very good. All right, let me go back into my screen share. Okay. So let's take a look at let's go through these steps of the SPF and see how media fits in here. So media data are collected through various means. Some examples include town and state websites. Now, what I mean by that is when you're looking to do a needs assessment in your community, consider looking at town websites, specifically reports to the town manager can be very helpful, as well as sometimes you can find police minutes. And these can shed a little bit of light on, DUIs that are occurring in your town. Sometimes they will talk about stores that may be illegally selling tobacco products to youth. And sometimes they will even give you some information on overdoses that may be occurring in your town. So definitely take advantage of looking at your town's websites and some local publications when doing this. This data is used to identify priority substances and associate risk factors and determine the best strategies to prevent and reduce substance misuse. These programs and activities are planned to address the risk factors and strengthen the coalition. So the next step of the SPF, capacity. So it's important to know that, remember, the coalitions are built on partnerships. And among the most important from the start are partnerships with local media and culturally appropriate organizations that can help disseminate your coalition's messages to audiences identified in your assessment. Media can help raise the community's awareness of your coalition and the good work that it does. It can also help recruit members, partners, and funders. Media can help educate the community about the dangers the dangers of drugs and the availability of treatment in your area. Then we go to the next phase of the SPF, planning. Now, it's important during this phase, you may want to consider to establish a communications subcommittee that will take the lead on your coalition's communication initiatives, including media advocacy and social marketing efforts. Your coalition should discuss, define, and write down your communication goals. Consider creating a logic model for communications. This should be realistic, measurable, specific, and prioritized. Make sure to engage the media sector and additional sectors to collaborate on the planning phase. Use media data to drive your strategies and your activities. Now to my favorite phase of the SPF implementation. This is really when we get out in the community and we get to put our plan into action. So some things to consider. Can printing your coalition's information in another language or using large print make it more accessible to the people you're trying to reach? Also, if you plan to utilize the parent-teacher group newsletter to reach parents of middle or high school youth. Most important, keep track of your attendance and the demographics of these events. Most of us have to report to our funders on these events. So get in the habit of tracking this. Now for the last phase, evaluation, achieving and reporting results. This should include quantitative data, such as tracking hits to your website or articles that were downloaded. Additionally, you should collect qualitative data, conduct a community survey or focus groups at several points prior to launch and during larger media campaigns to learn whether your messages are reaching and resonating with your target audiences, or if you need to adjust your strategy. Once you have the results from your data sources, create a presentation that displays your change over time on the goals and strategies you set. Identify these areas where you were successful and the areas that you still need to focus on in intervention. Now, again, we mentioned about these two overarching concepts that will go across the SPF, cultural competency and then sustainability. So again, you may want to consider, we mentioned before about printing in other languages, but it's important to know your community. I happen to live very close to New Britain. I know in New Britain, there's a large Polish speaking population. So I would be sure to print materials in Polish as well as English, but know your community. You may have several languages that you may want to be printing in, but also consider printing materials in larger fonts. Oftentimes as coalition coordinators, we are at events, sometimes for the proper way to dispose of medications and proper storage of medications at home. And we are dealing with a population of older adults. Make sure that they are able to see and read the materials that you have produced. And you'll notice here at the bottom, you will have in the appendix here, and these will be emailed to you, a chart that will describe more opportunities to integrate cultural competency across the SPF. And finally, sustainability. How is, media really contributes a lot to sustainability because you are capturing what your coalition has done and documenting it. This is, put this on your website. The more people see the good that you do in the community, the better of chance that your program has to sustain. And again, in the appendix attached with this, we'll get into that a little bit more. So now I'd like to shift gears a little bit and talk about the changing landscape of media. Now, media centers, a decade or two ago, were much different than what they are now. Media centers should actually be seen as a prevention hub for activities. And many of us now, with social media and website, we have a lot more control of the media that we put out there. But it's important to note that with this more control of content design and delivery comes a lot more responsibility on us. Now, what do I mean by this? I'm going to show you the next series of slides comes from a forum that I attended back in December about the role of media and the responsibility that media has in how language matters when covering topics such as this. So during this presentation that I attended, they had these slides where several studies were conducted, and I'd like to just share some of these with you. So mind you, in this one right here, these are mental health professionals. 500 mental health professionals read one of two vignettes and were asked to complete a questionnaire. The vignettes were identical, except in one, the individual is referred to as a substance abuser, and in the other, they were referred to as an individual with substance use disorder. The mental health professionals who read the vignette with the word substance abuser were more likely to agree that that person was culpable and that punitive measures should be taken. Let's look at the next study. Even though this is so subtle, but so insidious, the value judgments that come from this strong language. So 300 persons were asked to provide recommendations for two individuals. One person was identified as a substance abuser and the other was identified as having a substance use disorder. Let's see what those recommendations were. So substance abusers were recommended for punishment and were seen to benefit from a jail, quote, wake-up call. They were perceived as a greater social threat, having a personality problem, and that they should overcome their problem without professional help. The vignettes where people were identified with substance use disorders that were recommended for treatment or a psychiatrist and seen that they had a problem that is related to genetics or a chemical imbalance. The last study looked at 2,000 participants, and they were presented with vignettes of individuals with an opioid addiction that differed on two fronts, gender and language. They were referred to as drug addict or someone with an opioid use disorder. Participants were then graded on three areas: responsibility, dangerousness, and negative emotions. Now, I think everybody sees where this trend is going. But addicts were seen were more responsible for their condition. They were also rated with more negative emotions of anger. Male addicts were considered more dangerous than males with opioid use disorders. And also male addicts were rated with the most negative emotion. So, right here, this really just shows how language affects how the public thinks about addiction and also how people with addiction think about themselves. Even when the content may be using stigma-reducing terminology, titles may contain language to drive attention. What do I mean by that? If we look at some of these titles, we see some of these words: addicts, junkies, drug addicts. The use of these non-medical terms can trigger responses that call upon implicit biases and perpetuate stigma. So we want to be using language without stigma. We want to be using people first language and recovery oriented language. See this as your duty as a prevention professional. Put the words referring to the individual before their condition to avoid defining people by their condition. And what do I mean by that? I mean by a person in recovery as opposed to an addict. Use neutral medical terms that draw attention to treatment available to individuals contemplating recovery. Words like non-compliant or unmotivated or resistant imply that individuals have purposefully defied treatment. So I would like to just share with you an experience that I had working in the media sector from when I was a coalition coordinator. And the relationship, it's really interesting how it started. It started by creating bookmarks with our youth peer advocate. And what we did was we took a look at results from the Youth Risk Behavioral Survey, and we picked 3 data points from that survey that we thought were most important. We put those on the back of the bookmark, and then on the other side, we put a QR code that linked to our coalition website, which went into further explanation on the results from the Youth Risk Survey. So after we did that, we also purchased several copies of Dope Sick to hand out to the libraries. Now, the thing that makes libraries, very unique is that there are usually quite a few in every community. So it's not just 1 or 2. In my case, the community I worked in had 3 public libraries, 2 public high school libraries, and then several middle school libraries. So really, this was kind of getting a whole team assembled, of media specialists to be working together with our coalition. And we actually ended up using them as a hub for prevention activities. You can see in this picture right here was from when we did a book discussion during National Prevention Week. Now, I'm sure many of you can attest that having conversations around opioids can be a little bit difficult in communities. It's still a very highly stigmatized subject, and people are still somewhat uncomfortable talking about it. So we decided that by having a book discussion, that we could ease people into some of these conversations. And it proved to be very successful. We were able to have very meaningful discussions on the 3 waves of the opioid epidemic. We were also engaging people in conversations about medication-assisted treatment, which sometimes can be controversial. People have very strong opinions about some of these things. So this was a nice way to kind of ease into these discussions. We also used the libraries during this time to host speakers. We had a marijuana speaker come and talk during Prevention Week at the library. And we also displayed a bunch of the materials that our coalition had created around disposal and storage of medications. So definitely, take advantage of your libraries. They are all there, to help. And I'd like to actually, I'm going to stop sharing just for a moment, and I'm going to ask Terry if you could share real quick. I know that you worked with your local library and actually created bookmarks as well, and I think you did this during COVID. Could you just tell us a little bit about that activity that you did with the library?
Actually, I worked with our teen council, and we were, kind of a senior college mentor who's a part of our coalition and the teen council. And she really helped kind of structure the wording and help me choose and help the teens choose quotes that she felt would resonate with youth. We were doing a vaping campaign with bus tail ads and designing a community focused ad as well as a social media focused ad for youth. And we wanted these bookmarks to complement that campaign. So the libraries have served, or the library has served for us a place to distribute this information. So they were one of our kind of drop-off points. for the bookmarks to get it out into the community, as well as a lot of other places. And we cut a hole, or had the printer cut a hole in the top of the bookmark, and the teens put ribbons through that and then attached them to masks that we were giving out in the community, and still are giving out in the community, that had the teen logo on them. So it was a kind of a promotion for them too. But then they could take off the bookmark and use it.
I love that. I love that creativity. Another thing that thank you for sharing that with us, Terry.
Sure.
Another way too that the libraries, have been super helpful for us when I was a coordinator, was creating book lists for people in our community. And, I started out with the public libraries, and I asked them to create a book list for both young adults as well as older adults on topics related to mental health and substance use. We also did this in the high school libraries as well. And it was nice. We were able to share their book list that they created on our website. And they also shared these book lists on their website during Prevention Week. So at this point, I would like to, let me just pull up my screen real quick. So at this point, I would like to call upon our first speaker, Elizabeth Jadovich, former youth peer advocate for West Hartford Prevention Partnership, to talk a little bit about what she did in her role as youth peer advocate with interacting with media.
Sure. Hi, I'm Elizabeth. And I, like Ken said, was the youth peer advocate for the West Hartford Prevention Partnership from 2019 to 2020. At the same time, I was in my senior year at Trinity College, graduated in 2020. And I was also completing my senior thesis on the effect of media on vaping in young adults. So it was kind of like an interesting combination, perfect timing when I joined WHPP and was working on that also. And I was originally going to look at how social media and advertising kind of play a role in young adults initiating and starting using vapes and e-cigarettes. But as I started collecting the data, I kind of started to see that a lot of people were stopping using vapes and e-cigarettes. So it kind of, and the data was showing that negatively charged news articles and advertisements were kind of feeling this like cessation attempts. So it kind of shows like the duality of the media. So I thought that was really interesting. And it was really cool to see the WHPP and my own project evolve together and see the differences in age groups between WHPP and like college students, which was my focus. Yeah, so that's kind of how I got my start with WHPP. So I'll talk a little bit about my work as youth peer advocate. So for us, I think that our website was really the biggest way that we kind of used media to convey our messages and communicate with our community. One thing I did was I would write blogs in response to current events in substance use and mental health. I wrote one on the environmental effects of e-cigarettes and vapes. And then as the pandemic started, I focused a little bit more on mental health and alcohol use, because we're seeing a lot of increase in alcohol consumption and underage drinking during that time also. Another cool thing on our website was we had our student survey data front and center kind of, so it showed or we were able to communicate with the community what the certain risk factors and what substances were kind of issues in this community. And it also kind of helped us to show that the work we were doing was very data driven. It wasn't like random. We were kind of doing the work we were doing in response to the data we were seeing from the students in the community. So I think that was really important. We also just had like a wealth of information and media on vaping and substance use on the website, different presentations and graphics on different substance use issues and presentations that we made in the community. And another really cool thing that we had on the website was a section for news articles and different information on like current events. So we would have like 5 or 6 articles about vaping, opioid use, alcohol consumption, and mental health news articles that we'd switch out every couple days. And then when we switched them out, we would put them into an archive. So we had this kind of timeline of news events that were happening over the years that this project was going on. So it was cool to kind of trace different legislations and current events over the years with all these articles, and kind of seeing too like how the language surrounding vapes and e-cigarettes changed a lot, and like Ken was saying, how like using language is so important, and how it like how we talk about things affects how we perceive them and behave also. So yeah, and we also had lots of links and contact information for community, statewide, and national resources and programs surrounding substance use prevention and mental health promotion. So like different organizations in the West Hartford area, contact information for those, and also like statewide like Commit to Quit programs, and different national programs for helping quit. I think it was mostly for vape use prevention and quitting. So that was interesting. We also had a bit of a social media presence, mostly through Facebook. We would communicate with the community about upcoming events and different information that we needed to share with the community. And we would sometimes link back to our website, because I think it was really important for community members to kind of have access to the wealth of resources and information on the website. And also just different health and wellness posts too, like how to de-stress, especially during the pandemic. And I think at the beginning too, we posted like a little article on how to make your own masks, because it was hard to find, or they were hard to find, but now they're everywhere. But yeah, so just using social media to what we're doing. And yeah, so that was pretty much how we've been, or how we used media in our coalition. But if anybody has any questions.
I would like to just say real quick how fantastic the vaping archive that you created was. So it was, you know, we had it broken down by quarter of every year, and we tracked this for about a year and a half. And it was so nice because I think people in the community started, you know, realizing the value in this, and they began to approach us to participate in community forums on vaping and be part of panels and things like that. So the work that you did in creating that that vaping archive really did help us gain credibility and visibility in our community. So excellent job. But yeah, does anybody have any questions for Elizabeth? Please jump in. No? Okay, how is, can I just check in with my teammates and see how everything is in the chat box? Do we have any questions?
We currently don't have any questions at the moment, but
Okay.
if everybody wants to share your Facebook and Instagram pages there, that would be awesome too. Thank you for those who have.
Okay.
And we
Thanks
can-
for that, Shay.
We can create a list of those and get them out to people.
Excellent. Okay, so at this time, I would like to turn it over to Michael Awad from New Haven Prevention Council. And Michael, I believe you should be able to share your screen if you're looking to share some slides.
Okay, great. Can everyone see that?
Yes.
Okay, awesome. So nice to be here with all of you today. Thank you for the opportunity to share a little bit about the work we're doing in the New Haven Prevention Council with our youth campaign called One Step. So I'm going to be taking a different angle here, talking about the ways that you can use media as a platform for positivity and a platform to showcase good work that you're doing within your coalitions and within your communities. So our campaign is all about educating youth to just take one little step every day to change their health behaviors and to engage in behaviors that promote well-being and also reduce risk for substance use. So this is really important when you're trying to transfer this type of campaign to social media, because you don't want your messages to be laden with very complex kinds of instructions. You want there to be one clear takeaway of what they can do. So a lot of this was informed by current research that shows teens really prefer a visual medium for learning about news. This was a study performed by SurveyMonkey in 2019. 64% of youth prefer seeing pictures and videos showing what happened in terms of major news events. And more than half of them actually get their news through social media. So social media is quickly becoming the preferred method for getting information among our youngsters. At least 50% of them use YouTube to get their news a few times a week. And that's in contrast to only 37% who get their news on TV. So TV is starting to slowly phase out, and this is becoming the future by which we will be able to communicate with our young people. Something that really struck me here is that 60% of teens are more likely to get their news from celebrities and influencers. So one of the things that we did with our One Step campaign was create an influencers program. Influencers are youth within your community that have a certain level of clout or popularity within their social circles and can deliver messages to other people or other youngsters that would not otherwise be exposed to those messages. And when you're choosing influencers, there's really no criteria, believe it or not, other than them having a lot of enthusiasm and a good attitude. And it's important that you choose a mix of youth to be part of your influencers program. So students that represent different grade levels, students that represent different racial and ethnic demographics, students that might be perceived as good students, and students that actually might be perceived as running in social circles that are probably not as popular.
Could I ask everybody to put themselves on mute, please? If you are, thank you. Sorry, Michael.
No worries. As you can see, we have t-shirts for our influencers, and they essentially become walking advertisements for our campaign when they're at school and in the community, because on the back here, you see we have our social media handle featured on Instagram. We have our 3 core messages that we are trying to convey to our young people. And then it's also an opportunity to brand your coalition, your nonprofit, and the school district. So our influencers essentially become the front and center for delivering these core messages. And so our core messages are get involved, as you saw from the t-shirt, get connected and get healthy. And we translate these messages over social media through our influencers, but also through students across New Haven. So these are just some examples that I want to highlight here for you to see. So Get Involved is all about getting youth involved in pro-social activities that will reduce idle time, which, as you know, is a huge risk factor for substance use. You see, we have students portrayed and depicted that are getting involved in a range of activities. So not just sports, which is probably where a lot of social media tends to focus its attention, and the news in general tends to focus its attention around youth when it comes to sports. But we also feature students getting involved in performing arts like singing and culinary arts. And these messages are not just available through social media. When you think about the importance of making sure that public health messages are consistent across multiple platforms, it's important that you're also making them available in other mediums. So we have these same messages that are also available in New Haven public schools through print, so through posters. And so you see the combination of different media streams here through our influencers, who are sort of the human advertisements, through our social media, which is the digital advertisements, and through our posters and other promotional materials, which are the print advertisements. And these are just some get connected messages on our social media. So getting youth connected to adults, getting youth connected to positive peers that are going to help them engage in healthy decision making. So coaches at lunch, during school, after school with our influencers program. And then once again, these are carried over to print advertisements as well. And these print advertisements also feature the peer norms that we're trying to address. So in our annual health survey, we collect information on a range of dimensions related to well-being. And some of the things that we ask about are what percentage of your time is dedicated to participating in pro-social activities? What percentage of your friends run in social circles where you think they might use substances or where you think they might not use substances? And we report those percentages on our posters and on our social media. And these are just some of our Get Healthy messages. So youth, inspiring youth to engage in more of these healthy behaviors. This was a video by one of our influencers talking about ways to get outside during winter to stay healthy. This was right before the pandemic, 2020 healthy goals. And then we have our health center staff from across New Haven Public Schools that talk about how to access health services in the schools. And then once again, these carry over to print ads as well. So I really want to touch on this notion of using social media as a platform for positivity, especially when you don't have control of the narrative. So if you come from a large urban community where the news is just saturated with stories that don't highlight the good things that are happening within your community, then this is a way that you can really control what you want people to know and what you want people to see about what's going on in your community. With our campaign, we use health promotion as a strategy. So we do weave in from time to time overt messages around the harmful impact of using substances. But as a rule of thumb, we focus on teaching youth about health promotion and health literacy. And all of this taken together is just super critical for changing peer norms. I think especially now during the pandemic, when norms are even more skewed. When we talk to our influencers, a lot of them say that their peers are at home and most likely engaging in behaviors that are not conducive to health. But there are a lot of youth that are engaging in behaviors that are conducive to health, and we want to make sure that they are seeing those stories depicted. These are just some of the things that have come up for us during the pandemic. So we had a group of our influencers deliver pizzas to healthcare workers at Yale New Haven Hospital. This was right before the pandemic. We had a group of our influencers that were testifying at the state capitol for more prevention services and funding for these types of programs. And this is one of our school principals from New Haven getting tested for COVID and just normalizing that process for our youngsters. So especially when our young people come from families that are monolingual and don't have access to information in their preferred languages, in many ways, they're becoming brokers for this information, and they're sharing this information and knowledge within their families. So you can see that social media can just become a terrific news source for sharing news about individual accomplishments among your youth, for sharing announcements about school events and clubs and activities, for sharing announcements about community events and programs that you want your youth connected to. And so important now just for sharing health resources and COVID-19 information. And I am starting to reconceptualize our youth as journalists during the pandemic, and trying to figure out ways that they can once again be brokers for this information and knowledge that is so critical to share with families during this time where we're siloed and we don't have that in-person connection anymore to share information with each other the way we used to. So we've had our influencers partner with the school health center staff to create videos that indicate step-by-step how you access health services during the pandemic, how you schedule appointments. We've had some of our influencers do videos around how to get extra support for homework help, especially during remote learning. And some of our influencers depict ways that you can still be connected and involved, even though you're not together in person. You know, New Haven has not been in schools physically since last March. So they have been on this remote learning schedule from the very beginning. And then lastly, how you can use social media to engage with local media. Tag them in everything that you do. I found that they're bound to respond if they see something that you like. So a lot of these major news companies and local news companies are on social media themselves. So anything that you post, you can tag them in. You can also just direct message them and ask them to feature you. So if you've done something exciting, you can post it and then message it to any of your local news companies and ask them if they would share it on their platforms. I found another great way of getting their attention is just by restoring their content on our pages and our channels. So it's a nice thing to do because you're showing that you are in partnership with them. You want to share their information as much as you'd like them to share your own. So that's all I have for today. Thank you for your attention and your time.
Thank you, Michael. That was fantastic. Mind if I open the floor for anybody who has questions for Michael on anything that he just discussed? If you're shy, talk. Oh, sorry, go ahead, Lisa.
I would like to ask Michael how he keeps the young people engaged in the campaign.
So we run a weekly meeting and it's over Zoom. That's the only way that we can meet today. And we have team leaders who are usually undergraduate students from the area that serve as team leaders for a group of influencers. And in essence, it becomes a way for there to be this reciprocity in the process where there's mentoring, where there's constant connection, where, you know, it's not just a space about developing prevention messages and working on content that we want to push out through our various media channels, but it becomes a space to have fun and learn about one another and vent and talk about, you know, this really crummy situation that we're in a way that they might not want to do so in school with teachers and other people who might be in positions to evaluate them. So it's really a fun environment that we try to create weekly. We'll play games, we'll plan competitions, we'll do contests, we'll do raffles. And the youth who come stay because they've lacked that connectivity piece since last March.
We have looks like a question in the chat box here, Michael. How do you manage your skeptics that these influencers might make a bad decision and get involved in something less than positive that might affect your brand or your message? Because we know, like you alluded to, I mean, social media, I mean, it's really, there's a lot to monitor there, if you will, too.
Yeah, and I think that you have to realize that what you're doing is somewhat a drop in the bucket compared to what youth are exposed to and what youth are constantly seeing on their feeds. So you have to do something that's going to interrupt that cycle, even if it is working with a youth that you might not necessarily perceive as being like the model student or you know, the face of prevention. You have to involve as many youth as possible from across different circles for the youth that you're trying to get these messages to. It can't just be, you know, the captain of the football team. It can't just be, you know, the athletes. It has to be youth from across the spectrum. So if that includes youth that are not necessarily popular, that's great because you're reaching youth in their circle that you would not have thought of before, and they could be more at risk for substance use. So I take this sort of whole school approach to when we're selecting our influencers. And it's also an opportunity to actually give them a corrective experience. If you can get those youth that are most at risk involved, then that's like, to me, the best case scenario.
Do you think this model can work with parents?
I do. I think it's just a matter of logistics and getting parents involved in this type of work. So it definitely can. It definitely can.
And then the last question that came up in the chat box is, do these messages include harm reduction? And if so, could you give us an example of that?
Yeah, so I touched on this during the presentation, but we really emphasize a health promotion strategy. So we want to focus on teaching youth positive behaviors that they can engage in, rather than telling them, don't engage in this type of behavior, because on social media, they can just easily unfollow you or block you. And you don't want that. You want them to constantly be tuning into the awesome things that your influencers are doing and participating in. So if there is a harm reduction message, it's going to have to be delivered through another peer. It can't be delivered through an adult like myself. It can't be delivered through like the school principal. It really has to come from one of their peers to resonate with them. And it has to be, like you're saying, massaged into this larger health promotion approach that we're taking.
Now, can you describe a little bit to the recruiting process of getting diverse youth to participate?
Yeah, so this was much easier when we were in the schools, because I could just get to know youth from the lunch periods, seeing how they interact with their peers, seeing how they interact with their teachers. But the biggest, I think, success story, I'll say, for recruiting for me was finding the students who were wandering around the hallways during class. And this might touch on one of the previous questions around including youth that might not necessarily fit the prototype that you're trying to promote, right? So it dawned on me that a lot of these kids are not in class because they're not feeling connected to the information, or they're not feeling connected to their peers in their class, or they're just not understanding what the instruction is trying to convey to them. So I would literally just walk up to young people in the hallways that were cutting class and ask them, hey, tell me how your day is going. Are you missing class? Tell me a little bit about your class. What is it that you don't like? And, just finding ways to connect with them and start conversation, and then talking about the campaign and asking them on the spot if they would want to get involved as an influencer. And for 95% of them, it was just like, someone is recognizing something in me that someone has not before. Someone is seeing value in me. Someone is giving me a purpose where I might not have felt one before within my school community. And I'll say that our top influencers now, according to the principals that we've worked with, were the most at risk before we connected with them. And it's just been amazing to see so many of them turn a page and see that they can do things that are just so beneficial to themselves and to their peers.
Thank you. Thank you for sharing all these excellent points and insight on the great work you're doing, Michael. Okay, if nobody else, I don't see any other questions in the chat box. So at this point, I would like to ask Lisa Mason to talk a little bit about, Lisa is is heading a subcommittee for National Prevention Week on media this year. So I've asked her to share a little bit about, what the plans are for media and National Prevention Week. So Lisa.
Okay, sure. Actually, I'm co-facilitating that committee with Ken. We're working on it together. But as many of you know, National Prevention Week is a national health observance week that takes place the second week of May. This year, it will be May 9th through May 15th. I just saw it posted nationally on Facebook. Nothing yet on their Facebook page. On their website. It's sponsored by SAMHSA, Substance Abuse Mental Health Services Administration, which used to administer the drug-free community grants, and that is now CDC, but they still administer the state block grants. This is where the money comes from that funds the different resource links, Department of Mental Health and Addiction Services prevention programs, the LPCs, the CSC Coalition. So that all comes from SAMHSA. It will be December 9th through 15th, and it will be a virtual activities, virtual week. Again, we're assuming we still won't be able to connect. We'll still be social distancing by then. We did that last year for the first time. This year, we have a couple of ideas. One is we are creating a mascot, and it is yet to be announced, but we will be creating a little mascot. We have a committee working on that. That's going to sort of more personalize the campaign. So that should be coming out fairly soon. The second thing that we're doing is library outreach. We decided, based on the successful work that Ken and a few others have done with their local libraries, to do some library engagement and outreach. One of the things that we have observed is, because this happens in May, often LPCs and coalitions are, number one, already have activities going on, prevention activities, and we didn't want them to feel more pressure to create something new. So our advice has always been, if you can rebrand something you're already doing as fitting in with National Prevention Week, go for it. Tag it with National Prevention Week. The other thing, rather than creating something from scratch, if we could give you a package or an idea that you might be able to adopt. And so, based on the work that Ken did in West Hartford, we were thinking of library outreach. We know there are some coalitions or LPCs who already have a relationship with their local library, and this might be a chance to strengthen or enhance that relationship. But we also know a lot of folks haven't engaged with their local libraries, other than maybe calling them as a location, or a host for an event. So we thought this might be a way to engage those. We know a lot of people go to their libraries, not just to get books or DVDs, but also for programming. A lot more libraries are doing different kinds of community programs. They serve as community hubs. And so we thought this, and they also get lots of questions, sometimes on mental health, substance abuse issues as well. So this would be a way to build the capacity of libraries, as well as give local coalitions a new partner perhaps to engage with. So we have two initiatives. One is a statewide read aloud that we'll be working with the Connecticut Clearinghouse, that libraries, local families can connect with, and that is Gizmo's Possum Guide to Mental Health. And so what we're going to be doing is working with State Department of Mental Health and Addiction Services, who created Gizmo, Guide to Mental Health. This is an evidence-based strategy to teach children and families about mental health promotion and healthy coping skills. So we are going to have somebody read the book as a read aloud that anybody can attend, and then do some health promotion activities during this read aloud at the end of the story. So that's one thing we're going to be doing. And libraries can join us, and libraries may want to, if and when we open up, they might want to be able to host that in the future. And there are tons of materials on this that we can share with the libraries. The second thing we want to do is create a resource kit of materials that LPCs or coalitions can print out, post it digitally, and give to their libraries. So as Ken said before, book lists, and it can be a list that they compare. Do they have these books already in their libraries? Are these some books they may want to order, or DVDs? Have some bookmarks. Have some book discussion guides if they want to do a book club on a certain book. Have the opportunity for the local coalitions or the RBHAOs to include initiatives that they're working on. Are you working on a social marketing club, or social marketing campaign? Are you working on a parent outreach program? This is an opportunity to give some of that material, whether it's posters, whether it's social media that they can post on their websites, as well as some fact sheets, infographics, and then you can decide what makes the most sense. Do you want to include information on recovery-friendly communities, if that's something that you're interested in? Do you want to include something on developmental assets? I know my local library has a whole display on developmental assets because that's something our coalition works on. But also, some ideas for creating some table displays with books that people could browse easily. So that's what we're going to be working on. That's one of the things we're going to be working on. We're still working on some other statewide initiatives, but that's pretty much it. We wanted to let you know about the library initiative that we're working on, and you will be hearing more information either through your RBHAOs or through the Connecticut Clearinghouse. The Connecticut Clearinghouse, and they still have it, I think, up on their website. If you go to ctclearinghouse.org, they had at least a page or more dedicated to last year's National Prevention Week. So go to connecticutclearinghouse.org and search National Prevention Week. And like I said, they had a page of ideas of different links. So those are some things. If you have ideas of things that you've already done with libraries or other things that we haven't mentioned that you'd like us to include, either put it in the chat box or send us an email, mason@xsector.com, and I'll put my email in the chat box. But we'd love to hear your successes as well. And I'd be happy to answer questions if anyone has anything.
Okay. I don't
Has
see.
anyone done outreach before with libraries? Okay, this is helpful to hear. And one of the things I know, it really varies town to town. Some libraries are open, some come and you can, it's curbside pickup. Some allow you to actually go in. We heard that some of the rural libraries, are really operating, maybe one day a week. So we know there's going to be a lot of variety. So there's going to be a lot of variety, and range in terms of how much people can do this. But we're also thinking that this is something we can do, as the pandemic, as more as we start to open up, and that this is things that libraries can use in the future as well. And one of the things that we wanted to include was just helping families during COVID. How do we handle mental health and promote mental health during COVID as well? And I see somebody, Danny says they did a reading with Gizmo, but not through the library. Glastonbury has done that. They've done outreach with their library. Thank you. And I think Carolyn, yes, and Groton said they purchased books for the library and put them out for Prevention Week, as well as they house resource libraries. And I think there's one more. Did I miss it? Oh, book displays for Mental Health Awareness Month, along with ebook lists by age and ebook checkouts. So those are some other options. So thank you, folks, for sharing some of the things you've done. I appreciate it.
Thanks, Lisa.
Okay.
I wonder if I could put you on the spot, Nathan, from GPP. I know that you guys do some phenomenal work with media. Could you maybe share a few go-to approaches that you guys might have?
Yeah, absolutely. So one of the tricks to our trade, part of our secret sauce is that we use a program or an online service called Canva. And Canva, I know how to use Adobe Illustrator, but Andrew, who is the director, often jokes that that's coming at a lot of these projects with like a chainsaw when a butter knife could get the job done. So Canva is a pay for service. I think it's like $10 a month, but it offers a lot of social media templates that you can use to quickly generate content that looks pretty engaging and sharp. Another one of the things that we often utilize is this service called Hootsuite, which allows you to schedule out your Twitter, Facebook, Instagram, kind of all at like one-stop shop type of thing. So for example, I might post to Hootsuite something that I want to go out on Facebook, Twitter, Instagram, and even LinkedIn. And then I hit schedule, and then, say 5 o'clock comes around and it'll roll all those things out. Yeah, so I would say that's a big part of it. And also just, driving folks back to our website where we have different things happening. Right now, we're preparing for the Connecticut Mentoring Summit, which on the communication side is a pretty big lift. We're going to be doing a lot of things over Zoom and, just trying to create the most engaging experience for the mentoring providers possible. So definitely encourage you guys to check that out if you haven't signed up or looked at that yet.
Definitely.
And I'd be happy to answer any questions as well.
Does anybody have any questions for Nathan? Let's see. Okay. I noticed that Ramona and Stephanie from Demas are in the room here. Would you like to share with us any observations that you have on media?
It's Ramona, and I'm DPH, not Demas, but that's okay.
Sorry. I'm sorry.
No, we've been basically trying to get the word out any way we can. For us, I think I'm one of the few that picked TV and radio because, of course, we have a budget that we can do something like that. So I try to be respectful of any local health departments I'm trying to assist and make sure we can use our resources to get them to be able to use that kind of avenue as well. So I think that as long as you understand what you have available to you sometimes in partnerships, you can kind of access, leverage those funds. Because I know that working with different marketing companies, I always try to put out there with other partners, if you need something, please tell me, because that way if you don't have it in your budget, maybe we can work it into ours. So I think I would just recommend that to people, that just because you don't have it, reach out, be part of some kind of coalition and see if you can get it through some other resource. Yeah, don't be afraid of thinking big. I always tend to think way, way big. It's easier to cut it back. Think too small, you don't make the impact. So I'm always going for it. I'm sorry, my feed is a little weak today, so it was better if I didn't have my video on. I just wanted to make sure I didn't lose connectivity with all of you. And just trying to make sure we partner. Like I'll let Stephanie talk. She knows I'll talk all the time. And yeah, well, I love working with Stephanie and Demas folks. So I appreciate just having that ability to partner a lot. Thank you.
Thank you.
And piggybacking off of what Ramona said, one of the things that I could suggest too is just don't be afraid to ask. If you don't put the ask out there for either local partners, state partners, any partners that are out there, you'll never know and you'll never have an answer. So the worst thing anyone could say is no, and you're exactly where you started, and you kind of look at other avenues and other partners and just keep trying to move forward and build upon things. And you have to start somewhere. So even if you start with social media and you have like you have 2 followers or 2 friends on, you know, Facebook or whatever platform you're using, you have to start somewhere. So just keep putting the message out there and keep talking about it, and eventually it'll just keep growing.
Thanks, Stephanie.
And also think about the mutual goals that you may have. You know, most of us, you know, when we approach a partner, sorry, that's my dog and the mailman. You know, most of us, you know, have mutual goals. You know, we both want healthy youth. We both want healthy families, healthy communities. So, you know, explain what you're doing, you know, ask what their goals are. And I just want to give a shout out to A. Reyes, who talked about the recycling trucks. I know Lime Old Lime did this. They had no, for their social marketing campaign, they have no billboards. So they said, what do we have that's like a billboard? We have garbage trucks. So they blew up their ad, you know, their social marketing campaign, and put it on the side of the garbage trucks, went to a local garbage hauler. So, you know, sometimes we need to adapt given, you know, the community assets or resources we have, and don't be afraid to do that. I mentioned earlier what some folks did in Westbrook. The town assessor was part of their coalition, and she said, what about if we put these, if we shrink down one of our campaign messages to fit in the local tax bill that comes up, which went out the same time as graduation and, you know, what do you call it, prom season. So that's something they did. Westbrook also put their ad in their, to be able to reach families, their parks and recreation booklet that goes in the local paper. So, you know, there's different ways of, you know, think about who's on your coalition who might have connections to somebody. And again, you know, thinking of it as a community service, we both want healthy communities.
Excellent. Thank you, Lisa. So I'm just going to jump in. We're going to go through these next, the last slides a little bit quickly here. Okay. So I just want to take a look at the different levels of sector involvement here. You can take a look at this continuum that indicates increased levels of involvement, starting with no involvement, where it's basically you do your thing and we will do our thing. Then, you know, progressing to networking, where, okay, let's talk about and share some of the information about what's going on. And then we move into, I call them the 3 C's of, you know, coordination, cooperation, coordination, and collaboration. And these, when we get to these 3 C's, we're approaching some higher levels of involvement here. But, you know, these words aren't synonymous, and it's important to understand the differences. So cooperation, you know, I'll support your program and you support mine. This might mean writing letters of support for one another or sharing one another's agency newsletters. The level of coordination is, all right, let's go ahead and partner on this event. Let's plan this event together and start implementing some of these programs together. And then ultimately, you reach the collaboration phase where everything overlaps. You are pooling fiscal and human resources, and you're working on creating common workforce training systems. So together you are creating a comprehensive plan to address the issue. If real quick, we could take a quick poll on what level of involvement would you place the media sector in your prevention work. Let me just pull it up here. And if you could all go ahead and answer that. Go just a couple more minutes, let everybody get a chance. Okay. So let's see. All right. So we have, can everybody see those results okay? It looks like we have collaboration coming in as our number one. That's excellent. So we have some room to improve with no involvement in networking, so we can start getting into those 3 C's. So, okay, thank you everybody for, okay, let me go back to sharing my screen. Okay, so the following list here includes some ways to approach people to engage the sector of media. And again, I'm going to go through these pretty quickly here just in lieu of time. Some of these ways could be to invite members of the media to attend and speak at one of your events. Leverage media knowledge of communication strategies and to elevate event promotion. Keep in mind, media specialists, this is their specialty. They are experts in this. Use them to benefit your coalition. Host media-based focus groups on substance use prevention initiatives and ask for their insight. Seek to set a schedule for media that contemplates other time commitments. Anticipate and overcome roadblocks. Now, if we look on the right here, these are some ideas where if you already have some media representatives, but you would like to kind of drum up participation a little bit more. You know, one approach that you might want to take is to extend invitations for them to attend and speak at future activities. Highlight them as the guest speaker. Again, consistency of schedule for meetings. We're all creature of habits. Try to make your meetings consistent. It makes it easier for people to plan. Extend an invitation to attend a prevention team or task force meeting, and utilize existing or create new opportunities for media to engage youth. Some common barriers that we have to this sector engagement: competition or turf issues, possibly a challenged history between local agencies, availability of media sector participants. Perhaps you have poor links to the community, funding, maybe recruiting is a little bit of a challenge. So if we could go to our last poll here, and what are some of the common barriers you experience to engagement with the media sector? Launch this. And can everybody see that poll okay? Doesn't appear like this poll. Oh, sorry, I just closed out. There we go. I'll give you just a few more seconds for a few more people to answer. Okay, so let's take a look. Recruiting. Okay, so hopefully today we've learned a few strategies to recruit some participation from the media sector and to sustain it. So I hope you're able to take some of what you learned today and apply it there. Let me share my screen again. Okay, so the last slides here, you know, if you're not connected with your regional behavioral health action organizations, or you're not familiar with them, we've provided this page on the PowerPoint with links to each of their websites. and also to show which areas that they cover. Also, as I mentioned earlier, this is kind of a evaluation tool, if you will, on levels of collaboration. So you can put the level that you are interacting with this particular sector, and it'll help identify areas that you need to improve on. This is the other appendix that I mentioned before about how to integrate cultural competency across steps of the SPF. So again, this will be provided to you, as well as how sustainability contributes to the SPF. Now, at this point, I would like to just ask Shay if you could please put our evaluation link in the chat box. And we would appreciate it if you would visit that and give us a quick evaluation, only 5 questions on how we did today. I'd like to make an important announcement about a save the date for April 7th. We will be doing a cultural competency event with NEPTTC. And again, please visit our YouTube channel. Our YouTube channel features all the videos of these 12 sector trainings. And if you want to share it with anybody, this is the spot to do it. And I think we made it just in time with a few minutes. So does anybody have any final questions for me or for our presenters?
I just wanted to just reinforce something that Michael said and something that you said earlier, is in years past, we could depend on a local newspaper, you know, to cover events. And I don't know about other folks, but our local newspaper died, you know, during the pandemic. Or what happens is there's fewer and fewer reporters to cover. So, you know, I just want to reinforce what Michael said. We are now the creators of the media content, and to, you know, there's still folks that we can connect with, you know, by tagging them. But also more and more, we are the media content creators. So to think of expand our role of what media is, and to think about, you know, how we create content, who do we get help from, you know, to do that. There may be people in our community. The East Hampton Partnership, James Olson talked about how a graphic designer approached him because he wanted to develop a reputation in the community and wanted to give back to the community. So you never know sometimes where you're going to find these folks who can help you.
Good point. All right, well, thank you, everybody.
I was just going to say,
oops, sorry, Ramona.
I was just going to say, consider your audience, because sometimes it's a very simple thing. We're thinking big picture, like I was saying before, but at the same time, if you know who you're trying to target, ask them, where do they get their information? Sometimes it's a place you've never thought of. So they're the best content for you to access.
Good point. All right, well, thank you everybody for your participation. And like I said, this will be sent out to you along with your CEUs. Just give us a few days to get those sent out to you. But thank you very much.
Thanks, everybody. Have a great day.